the channel and who I am. So I dislocate probably about 5-10 times a day. So if something hurts, it really hurts and it's bad. And if it's beyond my pain threshold, it's scary and it can be dangerous. So I had severe pain in on the side that my appendix is on, and I still have my appendix, and I also had a fever. Wasn't a high fever, but it was still a fever, especially for me. I tend to run around 95 to 97 degrees just in general. So when I hit like over 100, it starts to get concerning, and especially with extreme pain near my appendix. So I contacted my doctor, who told me to get my tail to an emergency room immediately. I did wait 3 days, during which the fever kept going and the pain did not stop. So anyway, I had to go in just to make sure I was not having an appendicitis. I am not a doctor. I'm not a nurse. I was not qualified to make a diagnosis at home on whether I was dealing with an ovarian cyst or an appendicitis. I had to go to a doctor, and there were certain tests that had to be performed to make sure that I would not die. If you have an appendicitis, you can easily die from sepsis. And it becomes a far more dangerous and, in the United States, I hate to say this, but a more expensive procedure if your appendix bursts. So, by my doctor's recommendation, by all common sense, and by the fact that I do not have a medical degree and I cannot diagnose myself, I decided to give in and go to the emergency room. Now, I live in a pretty decent area. I do not live in a area that you would expect to not get good care, and I went to an even more expensive area, to the hospital that I feel is the safest one that I've had the best experiences with. I am very familiar with hospitals. Okay, so this is during COVID, and I have to give this hospital, we'll do another episode about the time I had to go back to the hospital. I went to a different one. This hospital actually handled COVID very well. All nurses, all staff were wearing masks. I was treated very well, except that the nurse who came in to start my IV screwed it up. First told me she had been kicked out of another room because after 10 tries, she was unable to start an IV with the other person, so she came to my room where she screwed up my IV, and I ended up with a lot of blood all over my arm. And for 45 minutes, the medication was supposed to go through, or not medication, I was getting a banana bag. If you don't know a banana bag, it's basically a rehydration. Yeah, for 45 minutes, I didn't get anything. And with my POTS, that created a huge problem. So already I had some really bad care. Nice people, bad care. So keep in mind, this is not like I got excellent care. Now, for the joy of getting my arm stuck by this person who screwed it up and it ended up with blood everywhere, I was charged $1,500. Yeah, just take that one in for a minute. To be physically harmed by someone, I was charged $1,500. Now, this isn't for anything else. This is for her to have stuck the needle in my arm. I was charged $1,500 to get an IV started. Now, for the blood tests that were performed, the first one was a lactic acid level, and that was $360. For a troponin protein analysis, I was charged $1,500. For a complete blood cell count, I was charged $335. For a bacterial blood culture, $861. I was charged $861 for a bacterial blood culture. That was twice. I don't know what happened there. A CT scan of the abdomen and pelvis was $1,900. Ultrasound of pelvis was $776. Ultrasound limited scan of abdominal, pelvic, arterial inflow, and venous outflow was $1,900. Hydration infusion was $1,195. Emergency department visit was $2,800. That's right. To walk in and to even see anyone was almost $3,000. An infusion of normal saline solution was $14. Yeah, so they say this was a total of $14,000. I should probably math that out. There were two things on that list that I did not agree to because I knew it would be charged and I knew my insurance would have an issue with it. Unfortunately, there were two things I really needed, so I guess they overruled me and did them anyway, and I was charged almost $4,000 for those two things. That is a $14,000 visit, to which I was there for 3 hours. I was bled out, and I had a screw up with my veins. And let's just set that all aside. I'm probably going to get my insurance to cover most of this. Hopefully, fingers crossed. It is going to take hours of time, and I'm sick. So it's going to take weeks and weeks for me to have the energy level to discuss this and deal with this. And let's put the more important issue aside here. I have the time to do that. Don't have the energy, but I have the time. Someone else who's working full-time, has kids that they're trying to deal with school stuff with, they don't have the time to fight this. And they might not have the insurance. So just because I might be able to make this okay, there's a lot of people who won't make this okay. And that means that every time a United States citizen feels like they might die if they don't go to an emergency room for 3 hours of care and no medication just to get this issue looked at, they might be looking at a $14,000 bill that their insurance may or may not cover, that they may or may not have insurance. That's just the reality. And I'm just going to leave that there. You know how I think if you are part of this channel. If you are not and you have issues with how I think, please feel free to comment below. But I don't think I should have had a $14,000 bill to find out if I had an appendicitis or not. And since it was an emergency. All right, there you have it. That's the justification a hospital gave for a $14,000 bill for someone who was not admitted, was only there for 3 hours, and was given no medication. There you have it. So just a little side note before I put this up, I'm kind of hoping that maybe some of you might be willing to do this too. If you want, please start videoing you reading off your medical bills, especially if you're in a socialized medicine country. I would love to hear how this works out for you, because I think the United States would be rather shocked if we knew what you guys pay for and what you don't pay for and how much you pay for even private insurance. If you're here in the United States, please start sharing your medical bills. I think it's really important we start doing this. I think it's really important we start showing how different the bills can be from hospital to hospital. So that was something I didn't cover in the video, which is if I had gone to a different hospital, I could have ended up with a very different bill, either plus or minus. And there's no actual, like, if you have an IV bag, it's this much. If you have this test, it's this much. It's different hospital. And they usually use billing codes, which makes it really hard to find out. So I was really excited to get this bill because I was actually able to understand exactly what was charged for what. So, hey, start sharing your bills. And I don't know, hashtag share your medical bills. Tag us at Invisible Not Broken, or just tag us at INB at Invisible Not Broken. And I think it's important that we start sharing what we're paying. I think it's really important we start talking very openly and loudly about this. I don't think this is a partisan issue. I think all of us have bodies pretty much, and they're all at different levels of ability, but at any point, at any time, we can become disabled or we can need emergency care. So I think it's really important that we have a very clear idea of what we're paying for and how much we're paying and what's happening. All right, thanks everyone. Be kind, be gentle, and in whatever way it looks like to you, be a badass. And right now, this is what it looks like to me. So that's what I'm doing.